Welcome, everyone, to a brand new webinar from Dynasty Dermatology. We are here to announce our brand new laser, UltraClear. So this is our virtual launch event with, of course, the one and only Dr. Chan. So if you have any interest in laser treatments or in rejuvenation, we are going to explain what this laser is all about and what it can be used for, why you might consider it over other treatments, and what is so great and why we're so excited about this new device. We also do have a promotion, so make sure to stay tuned till the end of the webinar and I will explain how that works. But before I hand this off to Dr. Chan, let me just introduce her. So if you are not familiar with Dr. Chan, she is a superhero dermatologist. She has over 15 years of experience, but I don't know, I can brag about her for a second. She probably doesn't like to do this, but she went to Harvard and Stanford. And although today she's going to be talking about lasers and aesthetic treatments, I just want to make sure everyone knows that Dynasty Dermatology is a full service dermatology practice. So we offer everything from medical dermatology, cosmetic dermatology, and surgical for skin cancer. And we're open Saturdays to make it easy for you guys. So without further ado, I am ready for Dr. Chan to start educating us all about this brand new laser. Thank you. Welcome, Dr. Chan.
Hi, I'm so excited that all of you made some time to join us today. And I am very excited to talk about UltraClear. I've been talking about it all the time because it can really achieve amazing things that no other device has been able to. And I'm excited to announce that this technology can treat all skin types. And I want to show you a little video that'll explain some more. So let's see.
The first. The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
We are talking about this awesome device, UltraClear, because it is the first of its kind cold ablative laser. And we'll talk about why that's important. But the really take home message I want everyone to understand is that every single person is actually a candidate for this treatment. And the reason why is because it can safely treat all skin tones, colors, ethnic groups, and with minimal downtime, with less pain. And it can treat all sorts of concerns that most of us have living in sunny climates, such as, uneven tone texture, pigmentation, maybe some acne scars or surgical scars, definitely wrinkles, fine wrinkles, as well as deeper wrinkles, skin sagging. It just kind of goes on and on. And so that is why this is an awesome device. And it also gives you the results without hurting you. So a lot of people are afraid to do a procedure, such as a resurfacing procedure. And that is because they don't want to look crazy. They can't take time off work. They have an active outdoor lifestyle. And the nice thing is we can use this device to really customize your treatment. It's very versatile. So we can choose the layer of skin and also go back and forth with different settings to treat all sorts of concerns. So whether you have melasma, acne scars, wrinkles, it's the same device. We just change the settings and customize your treatment. So, our practice is very diverse, and most of you have one of these skin types, right? Everyone does. Types 1, 2, and 3 are the principal candidates for CO2 resurfacing. So the old technology really could only treat the really fair patients. And when it first came out, CO2 was revolutionary because you could really turn back the clock 10, 20 years and really destroy those wrinkles. But then in so doing, you look like a zombie for 2 to 6 weeks, and you really were not presentable. You couldn't go outside, you couldn't wear makeup. And it really wasn't safe for darker skin types such as myself or anybody that has any sort of pigment because of the risk of post-inflammatory hyperpigmentation. What's nice is that we can really choose the level of treatment to offer. So whether you have superficial concerns or more advanced mature skin, this can be, dialed into your particular concern. So we in our practice will kind of consider three main levels of treatment. So superficial, so this is kind of the polishing of the skin. So, say you want to build collagen, you want to help some fine lines, you can't afford much downtime, and you definitely don't want to hurt. 3D Miracle treats the epidermis, which is the very superficial layer of the skin. And then we can move on to deeper treatments. The moderate treatment is with Clear and UltraClear and Ultra. So basically, Ultra goes down a little bit deeper and it helps to deal with deep wrinkles and other acne scars. There is a little downtime. You'll have 3 to 5 days of that downtime where you can wear makeup in 72 hours. And then finally, we have the advanced, almost surgical laser results with tissue coring, which we're going to talk about. But this can really lift the skin and achieve results that you would not be able to normally get with laser. And so we kind of talked about the levels of the skin. This is just a visual representation of how 3D Miracle's on the top layer. Ultra Clear or Ultra is the deeper, so that's more the wrinkles. And then the laser coring is even deeper than that, the deep dermis. And just to talk about this laser, this is brand new technology. Aclaro is an awesome company that has the leaders of its field, and this launched only 2 years ago, 3 years ago, really, and only this year is it really being used in practice more widely. But it's FDA cleared for fine lines, wrinkles, age spots, sun damage, and skin resurfacing. So this is another video of the IntelliPulse technology, which makes it so special. And it's going to explain how IntelliPulse is a combination of both blended and micropulse technology. And this allows for precise delivery of energy that can be customizable. So this is the blended visualization of both cold ablation and combining it with coagulation. And this basically creates channels in the same channel to maximize your results while minimizing downtime. We can dial up the coagulation and increase the energy so that we can customize your results depending on how much downtime you can afford. So it's very precise and it gives you optimal rejuvenation and collagen remodeling in a way that is much more comfortable. So you can see from this, you're treating multiple levels of the skin, which allows for multi-level collagen remodeling. And then the micropulse feature of this device is that it gives you deep ablation, but it does it extremely quickly. So it's ultra fast pulses that when it penetrates the skin, it's firing many, many times. And that makes the procedure much more tolerable. Okay, this is an example of an actual treatment. So I'll play the video here, and essentially it will show you, we do numbing cream for the deeper treatments, more mature skin. And, we can also offer sedation, and you would need a driver for that. We protect your eyes with a shield. And normally we just use these little stickers, and then we can choose the setting that treats the concern you have, and we can actually select the size of those little channels. So this is the fractionated aspect of it. So when we say fractionated, you're creating a little grid-like pattern of microchannels in the skin. These are tiny little micro wounds that are delivered so quickly, thousands and thousands of them, as close together as you decide in different shapes. And what it does is it promotes a wound healing response. So your body says, okay, I need to heal. So I'm going to now remodel my collagen, elastin, extracellular matrix to promote collagen. And as the skin heals, it allows the top layers of skin to kind of peel off and resurface, so to speak. So that gives you that polish. And then, that can be seen as kind of an exfoliation, a very light exfoliation over a few days, but actually deep underneath, you're seeing some changes occurring in the skin that appear months later, because collagen can take, 6 to 12 months to fully see results. So for instance, this person may look kind of crazy right afterwards, but after she heals, her body is still working to create collagen. And so I can't even truly judge the results for several weeks. But this is a very tolerable procedure. You see, it's very quick. There's basically no cutting, right? The laser is being very precise in delivering the energy. Then you can see some pinpoint bleeding, but that's very, very short-lived. Usually with carbon dioxide laser, that would require, you're looking like a bloody mess. Like you're just having to stay home because you're just oozing and crusting. But you can see, with her results being immediate post-treatment. Okay, so I wanted to show you some real photos of patients that have had this treatment and really to help you understand the level of downtime. I almost wish I had some photos of CO2 laser. So you can Google that, but that's kind of scary. So these are much more, reasonable results for, just one day right after treatment. So immediately after, you look like you've had a sunburn. But then after one day, this is the lighter treatment. You might have a couple little red spots, and then, by day 7, you're definitely back to facing the public. Now, the deeper treatments, the ultra treatments, you can see you're going to want to hide indoors for at least 3 days. So ideally, you'll do this procedure on a Thursday or Friday, and then, walk home with a hat and just kind of stay indoors if possible, because you're not allowed to wear sunscreen. You're not really allowed to wear your normal lotions and serums. We will provide you a kit or options to use for post-care, and you'll do some vinegar soaks. They're very easy to do, and then that'll really soothe the skin. And then by day 4, which is 72 hours after the procedure, you're back in makeup and you can go back to work. So this is looking pretty good by day 6, whereas again with CO2, it would be like 2 to 4 weeks of recovery and a lot more pain. Okay, so this is a really good example of the healing progression. So again, you look a little bloody the first day, and then day 2, you're starting to get a little bit more, a little less red, and then, but still healing. And then day 3, again, you're not really wanting to go out to, outdoors that much, but definitely by day 4, with a little bit of tinted sunscreen or concealer, you can look very normal. And then again, by day 5, you're back to work and looking good. And we can treat certain areas of the skin with a bit more energy. So around the eyes, around the lips, those are areas that people hate, the smoker lines, the really deep wrinkles. And instead of having to do a lower bleph or other surgical procedures that might cause blindness, you could do this laser, and you can even promote collagen ahead of time in your youth so that you don't get to, kind of the really saggy look around the eyes. And this is a great video. It's actually on Instagram, but I wanted you to see it. So you can see she wanted to deal with those wrinkles with movement, and she is definitely a bloody mess. For this kind of procedure, you'd want to use an eye shield. So we will use numbing drops and place the shield. I operate around the eye all the time with surgery, and you can see even with movement, she wasn't making those wrinkles. You can get some significant swelling. You can have definitely your eye swollen shut even day 2 afterwards. So we recommend you elevate and you ice, and then if you want to have any sedation, we can talk about that. So these are patients of mine that have had treatment. So this is a patient that wanted to address some acne scars, and she did have some active acne, but we were able to do the treatment, and you can see on the lower left, that's the next day. So that's the worst. I mean, I wouldn't schedule any job interviews or galas because you're wanting to hide home, right? But the next day is day 2. She's looking pretty good, not too red. And then day 3, the top right, she's 72 hours later in makeup. And that's her photo with makeup on. This is another awesome patient of ours who had the treatment, and we did the laser coring around the lips for the smoker's lines. And you can see the tiny pinpoint bleeding, the little grid-like marks. So those can linger slightly longer, potentially, 1 to 2 weeks. But as you can see on the lower left picture, here she has some makeup on because this is day 3. 72 hours later, she was in makeup and going back to work and seeing clients. She obviously all these patients gave us permission to post photos. So in the top right, that's 6 days later, and you can see remarkably bright. It addressed her pigment, her texture. So the smoker's line around the lips, again, that can take a little bit longer for the coring because collagen remodeling can take 3 to 6 months to really see major differences. This is just another picture of the side view. These are selfies. That's why the color is a little bit different, but it's obviously remarkable improvement with just one treatment. And this is a treatment around the eyes. So we did eye shields for this 40-year-old patient and really helped with those wrinkles, both on the forehead and around the eyes. And you can see even the little scar was improved in the middle of the forehead. This is the progression. Immediately after the treatment, he had a little redness in the eye area, but the next day, actually not too much swelling. We can offer you a little prednisone pack, a little Medrol dose pack to help reduce swelling. And then by day 2, looking pretty good. And then this is kind of the full treatment from top to bottom. So the bottom right is actually day 6. So pretty good for quick results around the eyes. And this is a patient that got the 3D Miracle treatment, but I actually modified it a little bit. 3D Miracle is a very specific setting for just the epidermis, so that top layer. We kind of pumped it up a little bit so I call it 3D Miracle Plus. And you can see she wanted to address the little spots, some of the fine lines, and this is just 5 days after treatment. So you can see it's a little dry and flaky, but what I really appreciate in these photos are the improvement of these little tiny early accordion lines around the mouth. And then on the other side, also the lines are better. Her skin just looks like it's glowing. And same with the forehead, the little horizontal wrinkles are much improved. You can see a tiny little grid if you look closely on the bottom, but nothing major, nothing that calls attention to itself. And I wanted to share my photos. So I didn't look so happy in the top left, but those were my pre-treatment photos. And I did this treatment the day before Thanksgiving because I wanted to assess the laser and make sure that it worked, and I wanted to see how it felt. And you can see I have these red, I look like a tomato, my face and neck. And then the first night, so the day of the procedure, that evening, I got little tiny pinpoint bleeding, and I was actually able to clean that all off. And I took another photo without it, but I was still red. And then the next day, it was Thanksgiving. So I had some explaining to do, but people, didn't really blink that much. I mean, I'm in the business, so they kind of expect that. And initially, the first week or two after, I was like, did anything happen? I wasn't totally sure. I healed, and then I just felt like I looked the same. But then I took a picture and I compared it. So if you just look at the bottom half of the face, you can see that the nasolabial folds are a lot less prominent. And then I'm still kind of flaking on the neck, but those lines are kind of cinched in. I mean, they're just not as prominent. I just look tighter and more refreshed. And then this was a picture taken with the same conditions, the same camera. And you can see my pores are improved. Again, the fold is something I really noticed. Like these little areas that I normally would want to fill and put filler are diminished. And I just look tighter, and even little wrinkles around the eyes, the very fine lines that only I really care about, nobody notices, are improved. And so people just started asking me why I looked so good. And I realized it was the laser, and I still look like myself. And I didn't have that much downtime. I was back to makeup, and actually, as long as you wear clean makeup, makeup is good to use afterwards. So, and this is a very light treatment. This is not the treatment I had. I had the deeper ultra treatment, but this is the 3D Miracle Plus treatment, like I said. And the biggest changes in this 20-something-year-old patient is the darkness around her eyes was improved. And I think that's because you're getting a little collagen stimulation, and you're getting rid of some of that epidermal discoloration, very top layer, and you just look refreshed. And this is a patient I recently did. She actually did the same 3D Miracle Plus treatment, which is very light and was tolerable. Just numbing cream, And she usually needs sedatives for fillers, and she was able to tolerate it fine. She says a lot less painful than electrolysis. And this was just 4 days later. So it's a little pink, but she was really pleased. And even her neck looked like it improved. So I want to just reassure you that this is a treatment that we've had firsthand experience with personally, and I really enjoyed the recovery compared to things I've seen about CO2. I'm not even a candidate for CO2, so this was great that I was able to try this. Okay, so this is the superficial treatment, some standardized photos from patients who have had it. These are just 1 month after one treatment photos. So, this is brighter color. You can see her sunspots are brightened. You would probably want to do a second or third treatment, which you can do about a month apart. A younger patient, the redness is improved. It helps the pigment and just looks polished. So it is safe for patients with melasma who have a lot of pigment. So just more photos, a little more subtle. I mean, we're not treating the skin too aggressively. This isn't hurt. So it's very tolerable. And the nice thing is you could treat off the face. So, certain CO2 resurfacing treatments cannot really be done on the neck and have to be fractionated. So this is a cold fiber laser. It's an erbium. So it does resurface the skin and it can really help that Southern California neck. Okay, so moving on to more moderate treatments with the Ultra. This would be your acne scar patient that has kind of depressions in the skin. And, we can combine this treatment with subcision or TCA cross or other treatments, but certain treatments are not safe for darker skin tones, but this one is. And you can see she even has a touch of melasma, but that didn't get worse with the treatment. This is a patient that is obviously a darker skin tone. And what I want you to appreciate is how her collagen is improved on her cheeks. And really this pigment on her forehead is a lot better after 3 treatments. So this was a remarkable photo also. You can treat sunspots. Usually a few treatments would be necessary. Again, melasma. This is 2 treatments with melasma. And obviously melasma is a chronic condition that requires kind of upkeep with topical agents, a little change in lifestyle, because you don't want to invest in the laser and then go outside without protection and get it all back. But you can see it really helped break up that pigment. And these are durable responses 10 months after the treatment. You can treat the hands, you can treat off the face. The hands can give away our age, so we often want to address that. This is addressing the crepey skin around the eyes. You can really see the blue blood vessels here where you can't after just one treatment. And, some patients just aren't good candidates for filler under the eye, as we know now that filler can last over a year, even years. So if you don't want any sort of risk with a foreign substance in your body, then this is the way to go. You can also use this to treat traumatic scars, stretch marks, sunspots, and you can get some skin tightening along the way. So not only does her skin look brighter, it's definitely better definition along her jawline. And again, you can treat right up to the eye. Some patients that would probably need to get surgery, you can improve without having to do filler. So again, this is a major problem that I think all of us face, not getting enough rest and just aging, losing volume in our face. And you can see with the treatment, just one treatment, 1 week later, she's looking really good. Just more photos, depending on your age. And I wanted to point out for this particular photo, I don't want you to think that the laser helped the red bruising. I think that's bruising. So I don't recommend this device for redness, like birthmarks or cherry angiomas. That's not the ideal treatment for those deep red spots. It does help overall skin tone, so you can see the redness overall is improved, and that is indicated. But don't think that it's going to help really dark birthmarks. Okay, so just another picture of acne scars and pigment, and the neck. This is really an amazing result. This is without tissue coring. It's just the ultra treatment, the moderate treatment. Several sessions, 3 sessions, but very tolerable, and the crepey skin is improved. Just younger patients with acne scars, all skin types, and 2 treatments for even better results. Again, scars, younger kids, it's very safe. And I love to show photos because it's just reproducible, and the skin tightening was pretty remarkable. Younger patients, again, the redness is better, pigments better. Okay, so let's move on to the more severe um, laxity of the skin. So this is going on to more tissue coring. So this is like surgical results, okay? So I want to show a quick video. So laser coring is basically the ability to remove little tiny sections of unwanted skin, and it coagulates, so there's no bleeding. It just kind of cinches it, and then as the skin heals, the skin tightens. So if you think about, Swiss cheese having holes in it, if you were to kind of close all the holes, you'd have less cheese, right? So the jawline can be lifted, and any of the saggy skin heals with collagen formation, and then it tightens up. So that's a great solution for those pesky areas, the smoker lines around the eyes, areas that are really hard to treat without any cutting. For the laser coring, there is definitely going to be more numbing, but it's something that anybody can tolerate with the proper protocol. So we can talk about different ways to do nerve blocks or some sedation if needed. But really nice results, the face and neck. Um, these are great, kind of, if you a mini lift result basically, and after 1 treatment. So this is the one and done. And 6 weeks is when you start seeing the collagen formation. So pretty impressive. The smoker lines, 1 treatment, and it hurts, but it's very fast. So the numbing and the protocols help you tolerate it, and it's not a very long treatment, so definitely doable. And so that brings us basically to the end of the presentation. So I'll pass it back to Risa, and we can do some questions and answers.
That was amazing, Dr. Chan. You just gave us so much information, and thank you for being so honest and transparent and even showing us what it looks like to heal, because a lot of people just show you the pretty after. All right, guys. So now is the time for Q&A. So feel free to pop any questions in here and we will get through as many as we can. We already have a few. All right. And then as soon as we're done with this Q&A, I'll explain the promotion. All right. So Dr. Chan, what does the recovery feel like? Is it kind of like a sunburn?
That is a really good question. So immediately after, you definitely feel hot, and we recommend you do some barrier creams. So we have in our practice, we recommend Epicutis. It's hyaluronic acid. We have a face mask that you can apply, which really soothes the skin, and then you can reapply the serums to hydrate it. It does feel burny. And if you put the wrong thing on there, it can burn very badly. So we really recommend you use something like Vani-Ply, or I like to prescribe barrier creams that are safe that first few days.
Got it. So can I get Botox and fillers the same day as UltraClear?
I have done both Botox and fillers for patients who have also had UltraClear. Ideally, you would do the filler ahead of time, and then do the UltraClear, because it can actually reduce some of the bruising. And then also afterwards, then at the very end, I would do the Botox. So the reason why is you can't lie down or exercise for 4 hours after Botox.
So how long do the treatments generally last? How would you have to repeat them? And if so, how often?
So it's definitely safe to repeat the treatments. And I think I always tell patients, you'll do the treatments to the level that you want results, right? So if you can afford a little bit more downtime, then as you saw, like it's like kind of one and done, you get really dramatic results. You don't really need to repeat them anytime soon. For the more superficial, the 3D Miracle Plus treatments, you may want to do a package of 3, and spaced apart like 4 to 6 weeks is usually good. And then also, like I said, if you continue to age, you just kind of you can't stop the clock, right? So luckily we continue to get, older and wiser. And then if you want to just reset that clock, you can sign up for another treatment. So basically what I tell patients, sorry, what I tell patients is that once you look in the mirror and you're just not liking the way it looks, kind of just get another treatment.
So most of the pictures you showed were the results of a one-time treatment. How many procedures do you think you need for the best results?
Well, so again, it just really depends on how much downtime you can afford. So like if you can really stay in, hide for 72 hours with makeup, then you can get those results with one treatment, right? But also keep in mind, laser coring is is best to be for the lighter skin types. So if you have darker skin tones, we would do a test spot. So we do laser coring, we would do like under the chin and see if you have any pigmentation concerns afterwards, because those little grid lines can be apparent. So like say if it's on your neck, you don't really care if you have some pigmentation. We can fade the pigmentation with lightening creams before the treatment and after, and that can improve your results. So I think that if you have a darker skin tone, we wouldn't want to just push the results so, aggressively, and just we would be safer to space it out over maybe 3 treatments.
Got it. All right. Kathy says, sorry, I have to leave, but this is so helpful. I'll ask at my next visit. Okay, Kathy, we'll send you the recording too. Everyone else, stay tuned. Okay, so here's a great question. How does this compare to Lumecca, which is another laser you have?
Yes. So everyone knows I love Lumecca. It is safe for all skin types, but I would say Lumecca, I wouldn't use for types 5 and 6 patients. So someone like me, or maybe slightly darker, I could use it, and it doesn't treat melasma. So Lumecca does not treat melasma. I just want to put that out there, whereas UltraClear can. Also, Lumecca doesn't treat acne scars. It doesn't really treat deep wrinkles. So Lumecca can, help with the sunspots. And I think it probably is a slightly superior treatment for just sunspots if that's the only concern. But if those sunspots are caused by melasma, then it's not the best option for you.
Got it.
It also hurts. I think it hurts slightly more personally, but they're both fat. So it's hard to say. I mean, everyone kind of has different pain thresholds for different types of procedures. So for instance, like if you poke me with a needle, I would not care too much because I would know that's over quickly, right? So I can basically put up with anything for a little bit, right? But I've seen patients who have Morpheus, for instance, and we have Morpheus in our practice, and it does really deliver great results. But for some reason, that particular treatment can not settle well with some patients. So this is really fast. It's just something that is tolerable.
Got it. So another question about Lumecca. I guess everyone knows you love it. So this ultra clear, it appears it could almost accomplish more, especially with the ultra. So would it
Yeah.
be a more aggressive, like a more results than Lumecca?
Yes. So, as you notice, I did the ultra treatment because, I don't have a ton of concerns. Most people would not say, oh, go get some laser. You really need to fix those spots. But I wanted to do this treatment because, I'm aging in my 40s and I wanted some tightening and collagen stimulation. And, it's a lot easier to do this, treatment rather than having to like upkeep with lots of mini treatments, right? So I don't have a ton of time in my life to do like 5 sessions of microneedling, right? Which you can get good results with that too. But I like treatments that give you results. And people know that with Lumecca, you can get results if you push the device. So people used to say you need 3 to 5 sessions of Lumecca, but people are getting great results of 1 and 2. So it's really depending on the target that you're trying to hit, right? So if it's for collagen stimulation, which basically everyone needs to kind of bank that collagen, that's why I would recommend this treatment.
Got it. So is it safe to do ultra clear on the upper eyelids?
Absolutely. So as long as it's over the bony area, we can actually pull the skin up and treat right under the bone. And we can decrease that spot size that you saw to very, very small, either rectangles, really few millimeters, and really get into the nooks and crannies, which is you can't do with Lumecca, by the way. So that's really nice. The spot size for Lumecca is quite large, it's rectangular. But UltraClear, you can customize the treatment. And then if you're brave, it's not that hard. You just put little eye drops. I put little numbing eye drops and put a shield in. And then we treat around the eyes, totally protected. And then we take out the shield and you go home. And it's you can treat up to the eyelid margin in that case. So if you were able to put the shield, if I were able to put the shield in for you, then you could treat all the way to the lash line. And that's how you get those results that you saw.
Wow. Wow. So you mentioned that UltraClear doesn't treat red spots. Is there another treatment you offer in the practice for the red spots on aging skin that just don't heal? I'm not sure what they're called. She said.
Yes. Okay. So we do have Lumecca that treats reds. So Lumecca is good for red and brown. We also can do some electrocautery to zap those vessels and the telangiectasias. So at this time, we don't have like an A+ treatment for like port wine stains. So those would be like the really dark, like purplish birthmarks. We don't have anything to target that. Because we have Lumecca, I've been able to get really good results with the telangiectasias using that. So this, UltraClear does help the redness. I just don't want you to think it can treat port wine stains, those really dark birthmarks.
Yeah. Um, so there are a lot of med spas out there promoting lasers, and a lot of them make some similar claims and like say that they can work like you showed us today. How is UltraClear different than those lasers?
So the reason why I chose this device compared to any other resurfacing option is that you're not going to find this device in a med spa. Like only really person with years of experience who knows laser technology, how it works, how to pre-treat, how to patient selection, how to dial into the settings. Only those kind of practices and providers are really going to be able to deliver the UltraClear treatment. So that's what in the end of at the end of the day, a lot of laser reps have recommended, their device because it's less downtime, this and that. But you're not gonna be able to get the coring procedure. And actually, later down the line, we're going to offer the surgical cutting mode for things like rhinophyma, where the big bulbous nose can be treated with UltraClear. It can actually treat precancers. There's just like so many options and so many indications for for this device that I think it would just confuse a med spa. And so the reason you would choose our practice and this device is that we're the practice that patients come to if they have a complication at a med spa. The toughest patients are not going to be treated at those med spas. They're going to come to see us, and we have a protocol. Since we treat skin of color, since we are, seeing dark, older skin, more mature skin, and patients who want results, we can push the device to get the results that you want with less pain, less downtime, and fewer treatments. That's the difference. Because I mean, you can get resurfacing with Clear and Brilliant or Pico, but I mean, you're going to need multiple sessions. And for me, I would rather save the money and do a treatment that will get you better results.
Yeah. But it's not just the UltraClear laser, right? It's also you, and because there's so many settings, could you maybe talk about that for a minute?
Right. So in addition to being a board certified dermatologist, I'm a fellowship trained cosmetic surgeon, and I did a cosmetic fellowship in Mohs micrographic surgery fellowship. So in that year of training, we did, every device imaginable. So tattoo, like hair removal, and we did fully ablative CO2, we did Fraxel, we did all therapy, we did all the procedures. And so with this device, it's exciting because there are things that we don't even fully understand. They're doing trials right now to grow hair with this device, to even treat really superficial tumors. So it's basically everyone's learning along the way, but the difference in the technology is that it's not bulk heating. So whereas CO2 would require all these mirrors and like kind of pumping up the energy, and it basically destroys the skin, right? So you have a lot of collateral damage. You're not just treating the wrinkle, you're treating like all the skin and like frying your face off. So with this laser, we can actually kind of combine the cold fiber with the coagulation, which then gives you the healing. And so it's much more comfortable of a procedure. And you can even decrease the level of redness that you can expect. If you don't want as much redness, we would decrease the coagulation. You can also, like I said, you can change the spot size. You can treat, off the face, neck, hands. So it's basically understanding the anatomy of the skin, what level you want to target, because you can literally target the level of skin that is concerning to you. So by going to somebody who knows their anatomy, then you can target, like the neck is different than the face, right? It's different than the arms and so um, it's really exciting. I mean, this one laser can toggle many different skin conditions.
I love that. And I mean, if it's just to put it in perspective with everyone, it's not just the tool, it's also the person doing it. So just like a layman explanation of this is if we give a paintbrush to me or to Michelangelo, we're going to get very different outcomes, right? So that's what we're
Definitely.
talking about. So it's Dr. Chan plus the Ultra Clear that's able to get these amazing results. Is there any risk of facial fat loss?
So this does not go deep like some other devices to melt fat. And as I mentioned, you can just treat the epidermis. So clearly the fat is deeper than that, right? So fat would be like 4 millimeters. You might start to get some changes, but you can definitely get sharpened jawline, but it's not going to treat fat. So we have a laser that uses ultrasound technology that can penetrate using ultrasound deeper, and that's going to melt fat. But even that device, you can use a setting that only treats the superficial layers, and there's really no risk of fat loss for that. But I mean, most people have a little submental fat in the jowls. But this is not a treatment for that. This would be more just overall collagen formation. It doesn't target that. So
Yeah. But you have other treatments to target fat. So I
yes.
guess, can Ultra Clear be combined? Like if someone wanted a little bit of tightening and some other treatments, might you put them together with a combination approach?
Definitely. And I think so even though UltraClear is awesome, there is some level of downtime, right? You have this recovery period. Um, and we have a device, Cell Sound, that has zero downtime. And you're a little pink from just the pressure, but it doesn't hurt. There's no numbing, there's no downtime. So that's great. But sometimes people maybe they don't think they have as much change because there's no peeling process. So that's interesting to me. But I show photos and then you can clearly see the difference. It's just, when you don't have the downtime, it's almost like psychologically, like, did anything happen? But it did. You just have to give it time and you have to do repeated treatments. So generally speaking, something doesn't hurt at all, you're going to need multiple sessions. That's kind of the trade-off.
But that's why you guys take before photos, because sometimes people come in, you show them and they go, wow,
Yeah. I mean, even myself, when I first had this treatment, I was like, did anything happen? I just like got red, and I was like red for my Thanksgiving photos. But then afterwards I saw the photos, and that's what kind of showed me that it does help.
Yeah, absolutely.
Yeah.
So, all right, two more questions, I think. So one, the big one, everyone's wondering, pricing. Can you give us any guidance on what to expect?
So we'll definitely have some introductory pricing. And for those of you who came to the webinar, we will have special pricing for you. And again, it really dependent on, how many areas you want to treat. If it's just the face, if it's just around the eyes, we'll have like add-on pricing for the neck. And then also packages. Obviously, we'll give you some sort of package discount. But I mean, on the order of similar to Lumecca for the light treatment, and then for the laser coring, that would be closer to like an Instalift price, or like that's threads. So basically ranging from like 850 to like 4,000. That's kind
Okay.
of the range. So like the medium treatments will be like closer to 1,500 or 2,000. That's kind of
Yeah.
a good.
And like with everything in life, you generally do get what you pay for, right?
Yeah, you really do. And also I read something about how we spend all this money on skincare. And you still need to do skincare, but instead of like reaching for something that's not going to get you the results you're looking for, or instead of getting a $25,000 facelift or $50,000 facelift with all the risks of anesthesia and nerve paralysis, I mean, that's kind of you're getting results without the cutting and without the risks of that.
Yeah, a much
Yeah.
higher safety profile. So
Yeah.
can you tell us a little bit, I think this is the last question, a little bit of what kind of a consult would look like and what the treatment would be like?
Yeah, so we actually started instituting this new protocol. So if you want to, send us some photos of yourself without makeup, you can call or text us. Our phone number actually can receive text messages. So you can text us to schedule a consultation, a complimentary consultation. We'll review the photos. So the provider who's planning on doing the treatment, like myself, would review your photos, and then we can give you a consultation kind of guidelines, but this is what I would do first, and these are the things that I would expect that would benefit your skin. And then you'll schedule some time to speak with an assistant who is familiar with all our pre and post protocols. So you can spend more time talking to them, and that would be like as complimentary. Now, if you want to spend face time with me in person, um, if it's a medical condition like melasma, for instance, I mean, insurance covers that kind of consultation. So I would love to, see you without makeup, take the makeup off, take photos, and then go really in depth, your medical history. This is a device that I would want to know if you get cold sores, if you get pigmentation after bug bites, after acne. And so, just your history of what you've tried, what worked, what didn't work, your lifestyle, like, are you going to be outside pretty quickly afterwards? Are you getting ready for a wedding? Is this just to like build collagen? I mean, there's so many things we can discuss in person, that's nice to do. And so we would try to schedule time for that. And so we would discuss and then make a plan. And I usually like to prescribe a medication for your recovery. So there are barrier creams that are by prescription that take a few days to get sent to you. So I like to recommend that. And then also it's less important because there aren't any needles, but you definitely want to avoid any medications that sensitize your skin to the light. You also want to be prepared to do some numbing cream, so you don't want to just show up for it. I mean, even the light treatments, we offer numbing creams. You might as well take advantage. And then, some people who are really concerned about swelling, they can take arnica pellets or bromelain tablets ahead of time. So anytime I do eyelid surgery, for instance, I always tell patients to do it like 1 or 2 weeks ahead. But for this, a few days should be good. But having that all handy and just not planning on, again, going to any job interviews right afterwards, so you have clear expectations about what to expect, and then you can ask all your questions. And if you want a little medicine for pain or discomfort or anxiety, we can discuss that. You just need a driver, and I do that a lot. Patients sometimes need it for very simple procedures, and we can accommodate that.
Yeah, I'm one of those people too, for sure. But all right, that was amazing. So I hope you all feel like you really understand now UltraClear and why Dr. Chan chose to bring this laser on. Obviously, she did a lot of research before so, and even treated herself to make sure that she's really bringing the best to her patients. It's so amazing. It's the offer of to let people text in photos. That's great. But I do encourage you guys to come in for a real consultation, because we love the UltraClear, don't get me wrong, but this is just one of the many treatments that we offer at Dynasty Dermatology. And so if you come in, Dr. Chan can really put together a comprehensive plan, which may be some injectables, some lasers, some skincare, some prescriptions, and so forth. So in the chat button, I pasted in a little the phone number you can text if you see that. It's also the number on our website. And Ruth says, thank you. Well done. Appreciate the consult offering. Thank you, Ruth. We look forward to seeing you. So our promotion. So yes, like Dr. Chan said, she's being very generous. And because this laser is new, we're excited to do some introductory offers. But we want to do something even more special for all of you that joined us on your Wednesday evening. So for you guys, every single one of you, we have your names recorded, and you will all receive a complimentary skincare product at the completion of your UltraClear treatment. And we have some really great skincare in stock right now. Plus, even better, the first 3 people to book their UltraClear will get 20% off your treatment and a whole complimentary post skincare kit that's worth over $100. So I encourage you all to text this phone number, 626-449-9992, and get on the schedule as quickly as possible so that we can book your treatment so you can be one of those first 3. I know I am so excited to get my treatment. I am already scheduled for a few weeks from now, and I hope you guys are all as excited as I am. This is the perfect time. It's, before summer, and just, a great time of year for laser treatments. So thank you so much, everyone, for joining us. Thank you so much, Dr. Chan. I know you had a busy day seeing patients today, and we appreciate you educating so many people right now. If anyone has any further questions or comments, please text us, follow us on social media, email us. But most of all, thank you so much for spending time with us. And we will send out the recording of this weekend, so you can forward it to any friends or family that you think might also want to hear about this new technology. This is so brand new. This really is the hottest laser on the market right now. And overall, we look forward to seeing you guys all soon and helping you just feel as beautiful as you want. So thank you so much, Dr. Chan, and thanks
Yeah,
everyone.
thanks,
See you
Lisa.
soon. Bye.
Bye, see you soon.